Welcome to the Beauty Briefing at Liberty, a new series where we discuss the key conversations happening in the beauty industry today. In this episode, I'm joined by two of London's most esteemed voices in aesthetics, Dr. Maryam Zamani and Dr. David Jack. Dr. Zamani is London's premier oculoplastic surgeon and an expert on facial aesthetics. She's also the founder of MZ Skin, an innovative science-led skincare brand born from her own research. Dr. David Jack is also a leading aesthetic doctor and skincare founder, who you can now see right here at Liberty, where he's opening a new aesthetics clinic in our flagship. Welcome, Dr. Zamani and Dr. Jack.
Thank you.
I'd love to ask you both briefly about your journey to get to where you are today. So maybe Dr. Zamani, we'll start with you.
So I did all my training in the US. I went to Georgetown and then GW, and I actually started a practice in the States and decided to get married to my husband, moved to the UK. Couldn't work despite my board certification, and decided that I would do more training while I was waiting. So I did oculoplastic and reconstructive surgery at Imperial and the Western Eye Hospital. And during that time, I started using lots of hyaluronic acid, which is what's in a lot of fillers right now. And on the back of that, I did a course with Cardiff in dermatology. And I decided that I wanted to offer everything from the surgical and the non-surgical. I did another fellowship in just eyelids because I love surgery. It's really fun. Finally, when I moved back in 2012, I started working as a surgeon, and I incorporated all the non-surgical. I bought a few lasers, I was doing injectables, and I also had my second child, had terrible melasma, and from there, went on a skincare journey. I thought, you know what, I'm gonna go for doctor-led brands. And there were some really great ones out on the market, but I became the non-compliant patient. So I started, and I didn't really enjoy the process anymore. And so I stopped using skincare, being super religious to never ever, wanting to, I was like, oh, I have to put these creams on again. And so I decided to create some ingredients to add to the brands that I really liked. So actually this is year 9 I'm about to go into of having MZ Skin, and we're, around the world, it's been transformed. It's a little brand, but we're small and mighty.
And Dr. Jack, how did you, because you come from a background of burns and plastic surgery, is that right?
Yeah, so I started in Scotland. Can't tell from my accent. But I started in Scotland. I started my career in plastics. I actually got exposure to aesthetics and skincare in the US though. I was over in the US doing a microsurgery fellowship and also with a kind of facial plastic surgeon. And she actually had quite a big non-surgical practice as part of her surgical practice, which really at that stage in the UK wasn't much of a thing. And she was doing a lot of work with people with things like volume loss because of HIV and things at that stage. And it kind of got me interested in what can be done non-surgically, aside from all of the surgical things that I was seeing in my NHS role. And I just decided when I came back, I was like, oh, I think I'd quite like to explore this a bit more. I did some courses. I found, because I absolutely love interiors and architecture and things, and I love the aesthetic of things, but I found that a lot of the things that were being done in a way that was kind of moving against the kind of right aesthetic. So I thought that there's definitely somewhere there, a place there for aesthetics that can be done well, make people feel good about themselves, but without making them look like they've had anything done. And I've got 4 clinics now, opening another one in Liberty, which is very exciting. And then I started my skincare brand about 3.5 years ago.
And it's such a privilege to have you both here, and I want to talk to you about your perspective on the beauty landscape today, because with the rise of TikTok, and everyone has become this armchair expert in aesthetics and procedures and treatments and ingredients. How do you both see the beauty landscape today, and what do you think is good about the fact that everyone's so knowledgeable, and what do you think is actually the downside of it?
Well, for me, I think, yes, everybody thinks they're an expert. I think when I look at things, sometimes things make me cringe. Sometimes people say things and they're totally inaccurate. My son came to me, I'm an oculoplastic surgeon, and he came to me with an eye thing, and I said, no, actually, that's not correct. And he said, well, it is correct, you're wrong. And I said, I love you so much, but actually, I think I know a little bit more. And I said, where did you get this? He said, TikTok. And I said, and who was the person on TikTok? He said, well, he was in a white coat. I think the things in aesthetics that I am happy about is that right now, it's wonderful that we have options that if you lack the confidence in yourself, or if there's something that bothers you that you can alter, whether it's non-surgically or surgically, there are options out for you. And the fact that people share their experience, I think, is amazing because one, it gives you insight. Two, it also makes you feel more relaxed knowing what the process all entails. Three, sometimes people have watched the entire surgery or treatment before they've even come in, so they know exactly what to expect.
No surprises. And,
you know, four, I think it's just a great way of education. There's a lot out there, but there's a lot of bad information or misinformation as well. The negative is that sometimes it sounds like what we do is a commodity, and it's like getting a blow dry or getting your nails done. And actually, there's real science. There's real technique. There's a lot of studies that, you know, both of us have gone through throughout the years to get to where we are, and other, you know, healthcare professionals. It's not a quick, it shouldn't be considered a quick fix. There are real complications that can happen, and I always tell patients, it doesn't matter if it's a 1 in a million. If you're that 1 in a million, you want to be in the hands of somebody who is going to be able to take care of you in the best possible manner. And so the difference between one person and another person doing a treatment is that experience.
Dr. Jack, I want to ask you, obviously you will be opening your clinic in Liberty. How do you approach a consultation with a patient? Like what's that process like, and how do you guide them towards the right treatment?
So I think you have to, as a medical professional, you have to approach it like a medical consultation. So obviously assessing the patient fully and understanding what they're looking for, what their background is, all of their kind of medical history, and also kind of assessing their motivations for doing things. Like Maryam was saying, it's really important that people do things that are appropriate for them, and I think that it's about kind of understanding the whole context of that patient, what they're looking for. I tend to, in my clinic, we work very closely with our estheticians to try and build quite full plans, thinking about all of the layers of the skin, thinking about how the skin is also going to age in the future, and how to kind of deal with that, and dealing with any skin issues as well at the same time. So it's kind of a holistic picture. We also have sort of nutritional therapy in our clinics as well, so thinking about the whole person to an extent. So it's very kind of medically based, but with a kind of holistic picture in mind.
What's one treatment or procedure that you're very excited about at the moment?
I quite like lasers, and we've recently just acquired a couple of new lasers, which are fractional resurfacing lasers, which you will see on TikTok and everywhere. That are these lasers that basically core holes in the skin, and then as the skin heals, it tightens everything. And I think it's very exciting because it's kind of the step between a surgical facelift and something gentle, non-surgical. And the results you can get are actually quite spectacular with it, particularly in slightly older skin, which is you're basically removing part of the surface area of the skin. So as the skin heals, it shrinks by that amount, and you're stimulating increase in thickness of the supporting layers of the skin, improving skin quality.
Which laser?
So this one's called Ultra Clear, which is and there's a particular setting of Ultra Clear called laser coring, which is I had a couple of months ago myself, which is not for the faint-hearted, I would say, but the difference that I've seen in my skin with that is more than anything I've tried in the past.
A lot of people are talking about regenerative aesthetics, which is essentially this, correct me if I'm wrong, but it's getting the body to do the amazing things it does naturally, but almost do them sort of to a greater extent, or creating sort of injuries in the skin so it then the skin heals itself better. I feel like I have not explained it very well there.
Exactly.
So maybe
that's exactly
Dr. Zamani, maybe you can
Yeah.
explain what regenerative aesthetics are, kind of why they're so popular at the moment, and also what are the treatments that fall under that umbrella?
The future of science is regenerative medicine, in my opinion. So, and not just in aesthetics, but in so many other things too. So what you said is absolutely correct. So historically, what we've always tried to do with energy and light-based treatments like lasers, or even microneedling, is to create an injury and then have that triggers a cascade of events in your body to then create collagen, elastin, and create new skin, because as we get older, the skin cycle becomes longer and longer. So when you're young, you cut yourself, like a couple days later, there's no cut left. You do the same thing on an older individual, and that cut is going to take just 10 times longer, depending on their age, to heal. And so the idea with all of these treatments is to create that and keep and maintain that level of collagen and elastin production. So regenerative medicine is great because it's harnessing some of the byproducts within our own bodies to create, not to create, but to harness the growth factors, to use the peptides, the amino acids, and things like exosomes, where the communication between cells, so that you're communicating within your body by injecting these products or these substances to create new collagen and elastin. So, things like PRP, platelet-rich plasma, which is when you take blood from your body, have it spun, and then you take the platelet-rich plasma, and then you either use it topically in conjunction with something like microneedling or a laser, or you inject it. People have been using it for joint repair, to hair restoration, to facial rejuvenation. And that's a great way to harness. Now we know we can also do that with fat. So you can get a very high concentration of stem cells, for instance, from your own fat cells. So you can take your fat, and again, you can prepare it in such a demeanor that you inject it back in, and again, you get an acceleration in collagen and elastin and that rejuvenation. Exosome is basically the particles within a cell that communicate with one another, and it's basically the signaling. So if you can get a signal into your cell to say, let's make more collagen, then you'll make more collagen. But I think all of that is coming together. So you're going to have laser stacking, you're going to have your injectables, you're going to have injectables that can be accelerated or made souped up, essentially, supercharged with your own growth factors, with your own stem cells, with your own exosomes. So I think definitely we're going to see more and more of that. I love it so much. So in my skincare, I have a 3-step method. It's reveal, enhance, protect, because like you, I don't believe in a big skincare routine. But I've always loved regenerative medicine and science, and so I've used stem cells and placenta. At first I started with sheep placenta, and now it took many years, but we created our own bioplacenta, which means that we've created it in a lab, again with lots of different growth factors and peptides to really help build the collagen and elastin from the outside in. So all of these things, whether it's in office or at home, they complement one another and sort of elevate the whole experience. So you're getting a 360 approach to rejuvenating your skin.
So one of the words that kept coming up there and that we hear a lot these days is collagen. So I want to talk a bit about collagen. Maybe Dr. Jack, you can tell us. So we're all being told, you need to ingest collagen, apply it topically. You haven't got enough collagen. You got too much collagen.
Never too much collagen.
Never too. Well, it's funny because as someone with quite a round face, I remember someone once saying to me, as you get older, you'll lose your collagen. I thought, oh God, God, let's go. Let's get the cheekbones in. But no, it turns out actually, now that I'm in my 30s, I do really want some collagen. So what are the myths around collagen, and what are the things we need to know about collagen?
Yeah, so collagen is probably one of the most important structural molecules in the skin and elsewhere in the body. And as we age, because of UV damage, sugar exposure, lots of different processes, we break down collagen, and that's one of the biggest factors contributing to us looking older, and other things happening like blood vessels showing on our skin and things. So a big sort of a facet of aesthetic medicine and skincare is actually trying to build collagen up again where it's been lost, or to maintain it over time. So there's a number of things that you can do lifestyle-wise to preserve collagen, which include things like using sunscreen daily, avoiding things that are going to cause inflammation in your skin, and then also things that you can do both with skincare and aesthetic treatments to help build collagen again. And with skincare, this can include things as simple as vitamin C topically, retinoids as well, which are a huge category of skincare, and then at-home treatments, and then in clinic treatments like the ones that Maryam was mentioning, that either create injury or stimulate collagen in some way. Things there's a whole plethora of treatments now that are designed to stimulate these cells that are called fibroblasts in your skin that produce collagen and other structural proteins. So there's loads of options now, but there's this new concept in aesthetics of collagen banking, which treatments like Profilo, fractional lasers, microneedling, all of these things work on building up that bank of collagen so that as you age, you maybe age a bit more slowly than you would have done without these things.
And what are the trends that you've noticed in the beauty industry because you've both been in medicine for so long?
I think that, Maryam touched a lot on them earlier on about this whole concept of kind of almost biohacking your skin, and it's becoming a much bigger thing now that people are very aware of, partly because of social media, and that's one of the good things, I guess, is that people are really into looking after their skin a lot better than they did maybe 20 years ago or something when I first started in aesthetics. So
when I first started, I was in a tanning bed in the old-fashioned UV bed, 20 minutes every day with an unlimited membership, and I went every single day for 10 years.
It's crazy.
Probably where my melasma started.
So people are really thinking about how they can really optimize their skin, and that's a great thing, is that the young people now always wear sunscreen, and but in terms of the way that the trends are going, I would say are these things that can help boost collagen production, that can help treat things that are maybe causing inflammation in the skin and associated with issues like rosacea and hyperpigmentation and melasma, rather than the trends maybe a couple of years ago where people were wanting to have big lips and big cheeks and very sharp jaw lines and look like celebrities that they'd bring in their phone and say, I want to look like this, which is a much healthier way of approaching the world of skin health, I would say. So thankfully that is a trend that I would notice, and in slightly older patients, definitely there is a huge fear around looking like you've had anything done, so these treatments fit very well into that kind of spectrum of patients as well.
I want to talk a bit about red light therapy and sort of light-based treatments, because again, this is something, there's a mask in your in your line, and also I think an eye mask. And this is definitely something where it has also almost become like a sort of accessory on social media. You see people, they post pictures of themselves doing their red light mask at home. How does this technology actually work? Maybe Dr. Jack, you can...
So it's using wavelengths of light that create cellular effects, and there are particular wavelengths that will create effects in the mitochondria of the cells in your skin, like the ones that we were talking about earlier, the fibroblast cells that produce collagen. And they basically work by creating tiny, very low-grade kind of injury states in the skin, in these in the mitochondria of the cells, and then you get these things released, which then cause cellular repair and build up of collagen and elastin and these sorts of things over time. There's also different wavelengths of light that work on, say, acne bacteria, that it can help to calm down inflammation and breakouts and things. So light can be used in a variety of different ways depending on the wavelength that's being used to create particular effects in the different cell types and the different aspects of skin health, and a really useful way to use as an adjunct to the skincare routine. And actually mitochondrial health is actually being recognised as a really big thing in the world of longevity generally, and this is a really exciting way of being able to do it at home.
Cool. How long do you have to wear the mask?
So actually that's a very good question. It depends on the piece of equipment that you have. So these are and should be FDA cleared and CE marked because they are medical devices, even the ones that you buy at Liberty or anywhere else. And so mine is a dose dependent, so it's sort of like a bell curve. And so at 10 minutes itself, it goes off on its own. And that is the exact dose that you need. It's like, if you're sick and you take a paracetamol, you don't take half a paracetamol, you take what the box says to take, or an antibiotic. So you wouldn't take more, you wouldn't take less. So it's very dose dependent, depending on what it is that you have. So mine is 10 minutes for, rejuvenation, which is red and infrared. They go to different levels of the skin to improve fibroblast activity. They've been used a very long time. I love this. I got really into this actually when I was doing my fellowships because we were using them on burns and post-surgical patients. You use them as you're supposed to. You do not do it multiple times a day. You do it one time a day. If you want to see a difference in your skin with at-home devices, you really need to give yourself anywhere between 4 and 6 weeks to see the cumulative effect. But of course, if you're going out and you've done like a nice little prep and you put some red and infrared light on your face, you're definitely going to look better. I'm a huge proponent of LED. I love it.
We can do the next episode, we'll all be wearing our
masks.
We'll do a quick 10 minutes.
Exactly.
So a big buzzword at the moment is tweakments.
Yes.
What is a tweakment?
A tweakment, I think, is, well, it's this phrase that's been coined by a very famous beauty journalist.
I get the sense you're not a huge fan of the phrase.
It's all right. I just think it slightly undermines some of the things that we're doing that are actually treatments, I would say, when you're injecting something into someone's face. But essentially, it's treatments that are kind of like things that you can maybe do quickly with low downtime. That's kind of how I would take a minimum downtime, yeah. So injectables, light lasers, these sorts of things. Yeah. So anything I would guess you would find in an aesthetic clinic.
I think it's trying to make treatments more palpable and make it seem like they're no big deal a little bit. So, I'm just going to have a little tweakment. It's not such a big deal. Whereas kind of everything you do in a doctor's office is kind of it's a deal. I mean, it might not be big. It might not be a big deal, but it's still it's still a medical. It's still a medical treatment. So.
And it kind of also gives this idea that it can kind of be done by people who aren't medical as well, which I think is one of the drawbacks of that word.
Yes, I would agree with that.
Yeah.
Dr. Jack, do you want to quickly touch on Morpheus 8 because that is a very hot topic.
It is,
and it's something that you do a lot of, and you're obviously. One of the top.
I don't know about that, but so I think I was one of the first people in the UK to do Morpheus. It's a technology that uses microneedles with radio frequency, which basically causes injuries on the skin, like what we were talking about earlier. Working on this concept that creating very controlled injuries will then create a response in the tissues to build up collagen, to tighten things. Morpheus is one of many machines that do very similar things, but it's probably been around the longest and it has a few patents that other machines can't do. There has been controversy about it because it was kind of oversold a bit to clinics. There are lots of people doing it who probably shouldn't, that are being way too aggressive with it. But if it's done in a very controlled way, at low settings, at low depths of penetration, it can be a really excellent treatment, in my experience. It can be used to tighten the skin, it can be used to break down fat as well, and this is where some of the controversy has come from, is that it's been breaking down fat in areas where people haven't wanted fat breakdown because practitioners have just gone too deep into the skin or gone too aggressively with levels of energy settings and things. But if it's used in a very controlled way, it can be an excellent way of kind of defining things, tightening the skin in a gentle way that is never going to make people look like they've had anything done, but make their skin look nice and healthy. And it is another way of kind of just boosting the kind of longer term collagen levels, so that maybe you age slightly more slowly than people who haven't done it. We combine it with a lot of things in clinic, so we can combine it with PRP or combine it with things like polynucleotides, the salmon sperm treatment,
facial.
or exosomes that Maryam mentioned earlier. And it's quite versatile. It can be used on the face. We use it a lot on the body as well for tightening skin where people have had a bit of weight loss, particularly post-pregnancy. Quite good for scars as well, again if it's used at the right energies. And it's one of the things that we do day in, day out in clinic, and it's a real workhorse, but just has to be done really carefully at the correct energy setting so it doesn't create any of the unwanted side effects, like any laser really or energy-based device.
I think whenever you have any sort of equipment, it really comes down to the practitioner and the person who's doing it. So experience is unreplaceable. Yes, exactly. And I always say, it's like having a race car, one person driving it versus, someone else driving it. It's not the same experience.
I want to talk a little bit about the aging gracefully conversation. People still love to talk about aging gracefully. Do you think it's possible anymore?
I think it's definitely possible, but I think that's changed perhaps.
Yeah, what's your definition of aging gracefully? Yeah.
What do you think your definition of it is?
I think it's looking the best you can at any age, and so I think doing anything that makes you feel more confident will have you live your best life. And so, aging gracefully is staying authentic to who you are without changing too much of your base. So someone should be able to look at you at 20 and then look at you at 80 and say, oh, I can see that you're the same person. You don't want to change yourself. But but to be the best version of yourself. That's what I think aging gracefully means. And I think it means about being confident and feeling happy in your own skin. And that doesn't just come with what you look like. It's about, I think it's a complete lifestyle. I think it's evolving how you look, and that comes with your hair, whether you keep it long, you keep it short, you cut it off because you've gotten a little bit older, you know, your nails, do you get manicures, do you keep them looking nice, do you just like them plain with nothing on? It doesn't actually matter what it is, but it's about being groomed in whatever way that grooming makes you feel confident and what you're at ease with.
Dr. Jack, I'll ask you feel free to add anything, but also I want to ask you, do you think that there's a lot of pressure on us all to be so beautiful today?
I think that there is and there isn't. I think that there's definitely different groups of people. I think that people, on social media, definitely there is, particularly if you're on camera a lot and things, there is this pressure. And that sometimes translates through to people looking at people on camera and on social media and things, which I think does very definitely run the risk of being quite an unhealthy thing. I think that there's also, I think there's, like, in the last couple of years, probably been this movement for acceptance and things, and people really not caring as much as well. And I think there is definitely a group of people who these sort of things just don't matter to, and that's absolutely fine as well. I think that, yeah, it's nice that there is choice and there is the ability to do these things if you want to do, and to feel like you're doing things to make yourself feel better. But it's nice that there's also, you don't have to do these things, and there are a lot of people who are just kind of fine not doing them as well. And there shouldn't be any pressure to do these things.
I want to say one thing, because I have a teenage daughter now, so she's 14, and I started reading this book called The Anxious Generation. Yeah. And I haven't read it all. I just only started, and I probably will now, since I'm not on holiday. It will take me another year to finish it. But the gist of it, I think, it can be very unhealthy for the younger generation. Kids have exposure and freedom to see a lot of things on social media that I don't think they're necessarily prepared for yet. So I think that is very stressful, and it can be make people very anxious when they're younger. And so, you know, that's the only negative side of it. So it's quite a substantial amount of people who get affected because they think, gosh, that person looks so beautiful, or, you know, and you don't know if there's a filter, you don't know if they've had makeup artists, you don't know if it's good lighting, you know, you don't know what it is that's actually contributing to that image. But that selfie world where everything is shared immediately, I think can be also very challenging to, you know, a developing person who doesn't, you know, their body's changing, their looks are changing, they don't actually know where they are. So I worry about that. That's my biggest worry in terms of, you know, where we're going with perfection. So it's all about being confident in yourself, because if you don't have that inner confidence, then there's always somebody who's going to make you feel smaller, unfortunately.
Well, Dr. Jack and Dr. Zamani, thank you so much for being our guests on the Liberty Beauty Briefing, and look forward to seeing you in store soon. Obviously, we're sharing opinions and talking about a lot of trending topics in the beauty industry, but none of this is medical advice. So if you are going to go ahead with any of these treatments, then make sure you do your own research and speak to practitioners yourself, such as Dr. Jack or Dr. Zamani.